Hi, my name is Dr. Rich Hillsden. You're watching my channel, Knife Skills. Today, I wanted to react to a medical student, NDMD, and his first week on clinical rotations. As someone who likes to create videos about the medical experience, I really enjoy watching the med students who have the guts to really be that vulnerable and share with us their experience training to become the future doctors. And I love it, just watching the next generation really cope with the challenges and stresses of training, which are many. It's just awesome for me to watch and reflect on. And NDMD, I'll just go to his page here really quick, has some awesome content, really covering a huge gamut of various subjects. Actually, one thing that's worth paying attention, these popular uploads right here, the 73 questions with doctors essentially who are either residents or in practice, is absolute gold. It's really interesting to see sort of what people feel about their own specialty after being in it. And I think that's a great way for you to maybe reflect on what you might want to do if you decided to pursue a career in medicine. But today we're going to watch this particular video here, trying to process my first week in medical school. So 3 a.m. is pretty early. I'm not sure why he had to get up so early. Even in a surgical rotation, typically you need to be at the hospital around 6 a.m., maybe at the worst 5:30. That might happen from time to time, but that's pretty rare. So it's interesting why he felt that he needed to actually get up so incredibly early.
Let's talk. Okay, I'm gonna use this reflex hammer as a microphone, pretend microphone, because I don't know why. I just finished my first week of clinical rotations, and when I say it has been the most physically, mentally, and emotionally humbling experience I've ever had in my life, I mean it with my chest.
So I think this is something that we all share. I can remember my very first rotation. I did it in internal medicine, and that first rotation almost broke me. You're not really prepared for the stress of being on the floor. You may have all the experience with the clinical skills. You may be acing your exams. This may be the dream for your career. And all of a sudden, you get hit with the reality of clinical care. And it can be hard to handle. So I'm not surprised there's a moment of excitement here, but also pain.
So as luck may have it, I began on a notoriously busy and hours strenuous rotation, which is OB, but specifically the subspecialty of gyn-onc, or gynecologic oncology. So we're dealing with a lot of cervical cancers, a lot of ovarian tumors, endometrioses, a lot of fun, well, not fun for the patients, but very interesting pathologies. But I don't think any sort of preparation could have really got me ready for what rotations actually is. Monday was just orientation, so that doesn't really count. The only thing it gave me was a simulation that told me that, wow, I was clinically rusty. I have not done medicine in about 5 to 6 weeks over break. And I walked into the patient room, a standardized patient room. It was pre-eclampsia. All the gears of what questions to ask, how to interact with the patient, kind of like had to slowly turn again. So actually starting off with the simulation wasn't that bad. Long story short, they had a simulated ultrasound where like you basically press a button as you do the ultrasound and it shows you like a pre-made image or video. And of course, it's a school, so pre-made images kind of suck. The standardized patient asked me, what does it look like? And I said, So that was day one. Day two.
So Andy's talking here a little bit about simulation, and simulations really become a cornerstone of medical education in 2022. Most schools are doing both standardized patients. They may have high fidelity models. One of the brands is SynMan. Andy's talking a little bit about an ultrasound model. We're using simulation really throughout medical training, and it makes sense because there are just some experiences in medicine that are rare but high stakes, and preeclampsia is a good example of that. You may never see a preeclampsia in your training, especially from a medical student perspective, but understanding what it is and recognizing it and be able to at least do the initial sort of diagnosis and treatment for preeclampsia is critical. And so simulation is a great way to get exposure to those rare but important conditions.
Came up with, hey, by the way, you have to be at the hospital at 5:30 in the morning to round, which, to be fair, I expected. Like,
all right, there we go. So he was told he had to be at the hospital for 5:30. So again, rounding early in a surgical rotation is really, really common. He's on Gyn Onc right now, which is essentially gynecology, especially a surgical gynecology rotation. It's going to be less shift work than maybe obstetrics. I'm sure he'll experience that. That'll be more shift. When you're doing surgical rotations, you need to be at the hospital so early because the operating rooms typically start at 8 a.m. And so you need to be able to see your patients, examine them, order the test, come up with a plan for those patients, as well as be familiar with the patients who are going to the operating room that day. If you're in general surgery, you may need to examine them before the operating room. All of that has to happen before 8 a.m. At 8 a.m., of course, is the traditional start time for surgery, but that has a lot to do with the other people that are being impacted by the work you do. The nurses need a regular day, so they show up at 7 typically to be ready for the OR by 8. Your anesthesiologists, really everyone needs to be ready to go within normal work hours. So you as a doctor have to accomplish so much more before the day even begins than maybe other people in the healthcare system. This is one of the challenges and difficulties about doing a surgical rotation.
this is kind of the stereotypical internal medicine inpatient type schedule where you have to be there super early to round. So I was like, okay, cool. Woke up really early and then like went in, introduced myself to the residents. All of them just looked up from their computers and then looked right back down, which I'll get to in a second.
All right. So that can be a bit intimidating. You're in your very first rotation, you're super nervous, and like the residents who are working there don't give you the time of day. Frequently, when a medical student's rotating, they're going to rotate on a rotation where residents are already kind of familiar with what's going on. They've been maybe on that rotation for a few weeks before if they're in a rotating type of program. Like let's say you're a family medicine resident and you're on obstetrics. That's not your home program. You're rotating on, but you'd be comfortable and familiar with it by the time the medical students come on, or vice versa. And so it can be a little bit hard to like take a moment to get away from that work that you know you have to do to sort of mentor the medical students. So I can see how it might be feeling a little bit intimidated on that very first day.
But I had no idea how to round. So they basically just assigned me a patient that they had on the floor and said, all right, read up on the charts and go in. So I'm trying to navigate the system, put together like a mediocre presentation. The resident was super nice, told me to make some corrections and how they normally do it in the morning. And then went straight to Gyn clinic after the morning rounds, which took about an hour or two, finished up my notes, went to clinic. And when I tell you, clinic can either be controlled chaos or chaotic chaos. My first day was chaotic chaos. I never knew why doctors complain about the electronic medical records until I started on clinic, because whenever I picked up a patient, it took me bare minimum 20 minutes to figure out why in the world they were even there in the first place. And then stereotypically, the surgeon or the gyn oncologist, who's the head of the clinic, you'd present to them, and you know, he got mad at me for not knowing why the patient's there in the first place, even though he didn't listen to half my presentation. And I'm like, why are you mad at me?
Yeah, so this is going to happen a lot during anyone's training. Obviously, the surgeon who's running the clinic is going to have some expectations, and maybe they're not going to be communicated as clearly to the med student what they should be preparing. And although Andy felt like he did present all the information the surgeon would have wanted, obviously there was a mismatch in expectations and communication. So I would say, I blame the surgeon there for sure. When I'm running my clinics, as far as I'm concerned, I want the medical students to participate and be involved. They do a great job. I mean, usually for the most part, they understand what needs to be accomplished. But if there's any uncertainty as far as what I'm looking for, it's definitely on me to clearly explain to the medical students what the expectations are. And if that's, having a clear history presenting illness, a clear reason for showing up to the clinic as the main priority, if that's what you expect, then it's important that you communicate it. I will say, though, on the other hand, just keeping that in mind, is that sometimes correction can feel like, someone's mad at you when you're a medical student. And I think it's really important for anybody who's watching this video. I know medical students, certainly some of mine, watch these videos. Recognize that even if the correction is not given in a super sensitive way, it does happen. Just keep in mind that the goal truly is to try to strengthen you as a medical student in the end, even if it doesn't seem that constructive.
I'm just as confused as you are. So already I knocked out a couple med student first day of rotation stereotypes. I got literally left on red by the residents, got yelled out by my attending for, no reason. And then just by the end of clinic, which was from 8 till about 3 o'clock, feeling utterly useless because you don't really know how to properly incorporate yourself to the med.
So that feeling of being utterly useless, I think, is a really common feeling at this stage. And in a lot of ways, it makes sense. You're not really making a big contribution to the team on your very first week. You hope you will, but it's hard to. You simply just don't know the ins and outs, the flow. It's hard to take on an area of responsibility when you're unsure how to present a case, how to examine a patient for that particular problem, what the main priorities are in that rotation, because every doctor in every rotation has a different set of priorities. So that's really important to understand. You're going to feel useless from time to time in your medical training. And I would say, be ready for that feeling, prepare for it, and know that it's going to get better as you know more, as you grow, as you get more experience, you're going to be able to make bigger contributions.
Then going straight from there to an OR case, which took about 3 hours. It was a robotic laparoscopic case, which is awesome. And scrubbing into a case for the first time. But that's when things started to turn around because the attending was super nice. She asked me like, hey, is this your first day? I said, first day of my first rotation. And she said, God bless you, child. Walked me through scrubbing in. The surgery techs were super, super nice. Like, that was the difference though. Where I thought would be me getting yelled at in the OR by scrub techs and attendings and residents, it was one of the nicest experiences I've ever had. And one of the best learning experiences I've ever had. And in the clinic, I got yelled at. So anyways.
So I love to hear that. The OR was a great experience for Andy. At the end of the day, the OR can be an intimidating place. You can make mistakes that cause problems. It's possible. So people get a little nervous. I don't want to touch the wrong thing. I don't want to contaminate myself. I don't want to do the wrong thing. It's such an intense environment. I've never been there before. These are the kind of feelings you might have. But it seems like in this environment, they were ready for Andy as a med student. The nurses and OR techs were prepared for someone who was brand new and really did support him, which is what I want to hear and see.
When you add up all those hours, day one was 12.5 hours, which I also had to come back home and study after. And that day nearly broke me because you're fresh. You're still learning how to be helpful, how to be useful. You're still introducing yourself to the people around you, and they're still getting used to you being around. And that's something med school, at least previous to this, does not prepare you for. I have never been so exhausted, so frustrated with myself from being able to hold my own preclinically to being so completely out of my element.
All right. So this is like a core experience that everyone is going to go through when they're starting their clinical rotations. If you're a student like Andy, you likely have been super successful in your academics up until this point, like 4 years. Your grades have been exceptional. Your ability to learn what is presented to you with confidence is just part of who you are. You're able to get information and regurgitate it and really truly even understand the concepts. But all of a sudden, you're transitioning from a moment where studying in the textbook is the key component of success to working in an environment where you become successful is by both applying the knowledge, but also taking the clinical, practical, real world experiences and learning from them. It's a huge transition and a huge growth. And from this stage on, for a medical student, once they start their clinical rotations, they move away from that book learning into real practical apprenticeship type learning. And if you can imagine what its apprenticeship would be like, let's say if you were an electrician or a welder, recognize that learning experience as an apprentice in those fields is going to feel totally different than the type of learning experience you're going to have as a university student studying in the textbook, going to the library, watching the multitude of Study With Me YouTube videos. That experience is completely different than the learning experience that you have to do on the job, which Andy's learning here. It's a new set of skills. It's a new experience to learn on the job.
Having all the here knowledge, but none of the experiential knowledge. But that's where I learned the hard way, but I think a very important way to give yourself some grace. Because as the days went on, and yes, they were also 12-hour days, except for Friday, because I got lucky and got out at 11:30 since all our cases wrapped up. But this process of incorporating yourself into the medical team is, in fact, a process. And it is tough love. There is no way around or under the wall. There is only straight through it. And all your residents and attendings know that. And you learn to not take it personally. What I learned very quickly after going through multiple 12-hour days is when I say hi to my residents at 5:30 in the morning and they just look up, it's not because they don't like me. It's not because I'm annoying. It's because they've been there since 4. When the
So this is absolute gold. I think Andy really expresses this well. You're a member of the team, you're participating, you're there to learn. There are going to be those times where you expect people to be a bit more social, a bit more open, but they're going through their own thing. The residents are under a lot of stress as well. They've got their responsibilities. They've got to get through their time, and they may not be able to give you the amount of attention that you think would be ideal to make the learning experience perfect. It's hard. So having a little bit of understanding that the people who you're working with are going through their own stuff and not to take it personally. I think that's really, really important. On all honesty, usually the experiences you have as a medical student, if you felt like the attending was yelling at you, I can guarantee you that the consultant that yelled at Andy earlier on in the video, and whether he actually yelled or just maybe expressed some feedback in a non-constructive way, I think that's probably more likely. But even if he did yell at them, that consultant, I'm sure, just felt like he was communicating in his normal way and treating Andy like any other person. Wouldn't have thought really personally about it at all. I can guarantee you.
Thing yells at you for not knowing why the patient is in the clinic. He's not mad at you. He's upset that the patient is not getting the right care that they need, or is in the wrong place to receive that care. And if you're sitting in the corner of the OR or off to the side looking at what's going on, it's not because you've been exiled. It's so that you can observe and figure out the places in the procedure and throughout both the pre-op and post-op where you can be a useful member to the medical team. Go get gloves. Go ask for people's sizes. Put pieces on for the bed. Put the stirrups on. Help move and transport the patient. Those are all parts that after 2 or 3 days of me being silent and observing, I picked up on.
Yeah, this is another great point. Do your best to find those small little ways that you can help. And you may not know right away, but I would say if you're a medical student, you're better off trying and getting kind of told that you're doing something wrong, which will definitely happen, than doing nothing. Go out there, take a risk, try to help out where you can. You will be corrected where you need to be corrected. But the fact that you're showing interest, that you want to try, and if you can get over the fear of being told, you're doing the wrong thing, that can go a long way to really make an impression, but also enhance your own learning.
And so near the end of the week, I'm tired. I'm running on not a lot of sleep at all. But I sympathize for these residents and attendings now. And the biggest lesson I learned, to be honest, is just be helpful and be kind to everyone. Because some of the patients I've seen have some pretty rough cancers. And when you talk to a resident or doctor, you don't know whether that was hour 2 of their day or hour 16 of their day. And you don't learn to sympathize with that until you put in those 12, 13-hour days yourself. And you know how it feels to be that tired, but still show up. And to me, that's why I'm so excited to be here. As tired as I am, and as much of a culture shock as it is, this is what medicine is all about. Working as a team and trying to get that patient home and better. So let this be encouragement to anyone out there, whether you're in medical school or you're looking to be here one day. Here's your first warning that it's just as hard as people put it up to be. You will be challenged, not just up here, but here and physically. It's going to push you to your limits. And as much as I'm saying that now, I'm going to be pushed even further. I know it over this next year. Look at me, I'm slurring my words, I'm not tired. But it's worth it because I've learned more in these past couple days than I probably have in like weeks of the preclinical stage.
I can guarantee that those first days, Andy has learned more about what it means to be a doctor, what it means to work on a clinical rotation, what it means to take care of patients in the hospital, than really probably his entire medical school experience up until then. It's only on the wards when you're working with more senior doctors than yourselves, taking care of patients, putting yourself in a position of stress like Andy has, that you truly learn.
And that to me is so, so exciting. So for the people that want to be here, enjoy where you're at right now. You'll get a lot more sleep, but look forward to what you have in the future. Be kind to everyone around you. Look for ways to help, and you'll be all right. Oh, and I got to scrub into my first case, place 2 Foleys, close up a laparoscopic excision for the first time, have to do a pelvic exam on an 89-year-old, and got to tell someone they're cancer-free. So overall, decent week.
I love that. He definitely saved the best part for the last there. I mean, the opportunity to scrub in the operating room is probably one of the best experiences a medical student can have from my perspective, for sure. And being able to sew skin or do something on the patient in the operating room is an incredible opportunity. I'm always impressed by the medical students who are vulnerable enough and confident enough to share their experiences on YouTube for the rest of us to enjoy. It's exciting to see sort of future doctors, people who are really a generation or two behind me in some ways, coming into their own. I mean, eventually Andy will make it through med school, make it through his residency, become an attending physician himself, and will be mentoring and teaching and leading. And so it's awesome just to see that shape come through. Certainly in my own experience, those first weeks on clinical rotations were by far the hardest. And I had the biggest doubts of my career. I had many feelings of, should I be doing this? Should I be a doctor? What else should I be doing from those clinical experiences? But over time, you develop your confidence, you develop your sense of self and how you can contribute to the team. And then you start to just become the doctor that you're meant to be. Anyway, it's great watching this video. My name is Dr. Rich Hillston. Please like and subscribe. If you have any comments down below, I'd love to hear what you have to say. And if you have any experiences in your medical school career, if you're a med student watching this, or if you are someone who's recently finished their first couple weeks on clinical rotations, I'd love to hear how that experience went down below. Thanks for watching.